Hello friends, today we can learn atrial fibrillation. It is an irregular and often very rapid heart rhythm that begins in upper chamber of heart. In other words, it is a type of arrhythmia in which heart beat in chaotic fashion. Chaotic means it's a state of disorder or confusion. Normally, electrical impulses starts from sinus node, which is called natural pacemaker. What is sinus node? It is a single point situated in right atrium. What happens in atrial fibrillation? You can see in the picture, electrical impulses are generated from multiple locations in the upper chamber other than a single point. This makes irregular and rapid heart rhythm, which is called atrial fibrillation. Always remember that in AF, disorganized electrical signals or impulses are generated. Then, these disorganized signals are then transmitted to the ventricles and it causes them to contract irregularly and quickly. So, the heart rate will be always more than 350 beats per minute. Let's move to etiology, congenital heart defects. It means defects in the structure of heart or great vessels that present at birth. Sick sinus syndrome. It is a type of heart rhythm disorder that affects heart natural pacemaker. Then heart attack, heart valve diseases, high blood pressure, lung diseases like pneumonia and sleep disorders. What are the signs and symptoms of AF? Excessive fatigue, irregular heartbeat, heart palpitation, shortness of breath, syncope or fainting, angina, it means chest pain, fluttering sensation or thumping in the chest, it means you feel like a butterflies in your chest. Then types of atrial fibrillation, paroxysmal AF, persistent AF, long-standing persistent AF, permanent AF and lone AF. Next, diagnostic measures for atrial fibrillation, auscultation and palpitation. Auscultate for apical pulse in the fifth intercostal space at midclavicular line and palpitate for radial pulse. Blood test. It includes TSH, CBC, electrolytes, glucose, kidney function test, BNP and D-dimer. D-dimer is mainly doing to detect any presence of blood clots. In case of asymptomatic atrial fibrillation, we can do microRNA blood test for early detection. Next one, ECG. This is a quick and painless test, measures the electrical activity. Holter monitor, a small portable device that records the heart activity. Echocardiogram. Here, sound waves are used to create images of beating heart. Transesophageal echocardiography, TEE. It uses high-frequency sound waves to assess the structure and functions of heart. During procedure, a transducer-like microphone is inserted to esophagus through mouth and taking the pictures of heart. Chest X-ray. Event recorder. This is a device like Holter monitor, but it records only at certain times. Implantable loop recorder. This is a device records the heartbeats continuously for up to 3 years. Exercise stress test. These tests often involve walking on a treadmill while heart is monitored. It monitors how heart reacts to exercise. ECG interpretations. In AF, atrium is fibrillating instead of normal heartbeat. So you can observe fibrillatory waves in ECG. There is no P waves. You can see narrow QRX complex and the distance between QRX complex also varying. So, irregularly irregular, narrow QRX complex is the one of the ECG findings in AF. What happens to RR interval? It also varying. So, varying RR intervals, fibrillatory waves instead of P waves, irregularly irregular narrow QRX complex are the ECG findings in atrial fibrillation. Treatment of atrial fibrillation includes administration of medication. Drugs beta blockers like bisoprolol, calcium channel blocker like verapamil or diltiazem. Blood thinners, it includes injection heparin and nowadays direct oral anticoagulants also available. Administration of antiarrhythmic drugs. Let's see the procedure. Catheter ablation. It uses small burns or freezes heart cells to cause some scarring on the inside of heart. Risk factors includes coronary artery disease, high blood pressure, obesity, smoking, caffeine and alcohol usage, stress, and history of arrhythmia are at risk to get AF. Complications include heart failure, stroke, it's due to blood clots, and heart attack. If this video really helps you, please like, share and subscribe my channel. Thanks for watching.